Hello, I'm Paul Peterson. Although alcohol and substance abuse is statistically at epidemic proportions among the elderly, it remains for the most part unreported, undiagnosed, or ignored. The reasons that substance abuse by our senior citizens goes undetected are varied, but most have to do with the fact that they are no longer active in mainstream society and there is simply no one around to notice. Our topic today, senior substance abuse. Please stay tuned for Aging in LA. As the baby boomer generation becomes part of senior citizen status, carrying with it the habits and patterns of behavior developed in the 1960s and 70s, alcoholism and substance abuse among the elderly could develop into a healthcare crisis. Treatment for substance abuse has increased by 32% according to a recent study released by the Federal Substance Abuse and Mental Health Services Administration. The administration predicts that the number of people 50 and over who will need treatment for alcohol and drugs will triple in the years from the beginning of the century to 2020. Alcohol is still the primary substance of abuse among older adults, but the proportion of older admissions to treatment reporting alcohol as their primary substance declined from 86% to 77%. Drug admissions, however, among those ages 55 and older has increased by 106% for men and 119% for women. One treatment center for alcohol and drug abuse is the Stuart and Linda Resnick Neuropsychiatric Hospital within the Semel Institute located at UCLA, which provides a geriatric psychiatric inpatient unit for senior citizens and is devoted to teaching, research, and patient care. Our guest today, Dr. James Spahr, practices geriatric psychiatry at the hospital and is recognized expert in the treatment of substance abuse among seniors. Thank you, Dr. Spahr, for joining us. It's a pleasure to have you.
You're welcome.
This is a profound subject that touches everyone's lives. Let's start with basic stuff. What is substance abuse?
Okay, substance abuse is the less serious of two categories of abuse of psychoactive substances.
Okay.
That is recognized by the official diagnostic scheme of the American Psychiatric Association. Substance abuse is diagnosed if you continue to use psychoactive substances, and for purposes of discussion, let's talk about alcohol, despite getting into trouble. Either you can't function in some important role at work, at school, at home. You continually put yourself in dangerous situations. You develop legal problems, driving under the influence. Or you have persistent interpersonal problems.
Right.
And by the definition, if you have any one of those four things in a 12-month period and you continue to drink, you're a substance abuser.
I've got you.
Okay.
Now, you mentioned something just before we started the program which is important for our audience to keep in mind. We have a population of current seniors right now with their specific statistical realities, but we have an explosion of boomers just starting now to, they're just turning 60 starting in January 1966 or 2006. They're coming, and there's about 80 million of them, and they're going to bring with them these habits of alcohol and particularly drug use. How are we going to prepare for that?
Well, as one of the members of that baby boomer generation,
I got you beat by 3 months.
Yeah, I can tell you, you're right. I think it's going to happen, and well, two things. One is the dire predictions are probably not going to come true because, the other thing about my generation is while we, as a generation, tend to use a lot of substances, the great majority of us have learned to use them in moderation.
Yes.
And,
exactly.
we're not substance abusers and we're not substance dependent, which is the more serious diagnostic category. And so I think, the statistics are going to get worse, but probably not as worse as everybody thinks. Still, treatment facilities are woefully inadequate as it is, as you know, and something's going to happen. I think there's going to be a lot of pressure to develop more treatment facilities and more experts.
And more experts. I think that's really going to be the key. It's so easy to isolate yourself in a particular area of study or category and say, well, I'm a person who is disabled, but it's not anything to do with substance abuse, and meanwhile you're spending $300 a month at the pharmacy. And I see that all the time now. It's becoming a larger problem. And for our seniors who were not children of the 60s as I was, they're a little leery of drugs. They spent so much time raising children and trying to keep them away from drugs that when they take their medications, it's almost as if they're a little afraid of what they're taking. But abuse is possible without it being a conscious decision. Isn't that correct? I mean, there are drugs that can slip up on you.
Well, now you're talking about prescription substance abuse, and I think really amongst the current generation of older folks, actually there's two generations, people, let's say, mid-60s to early 80s and people above 80.
Right.
Both of those generations have done fairly well with substances. If you look at the statistics, the prevalence of alcoholism, or substance abuse or dependence, which covers the two categories, with alcohol or other drugs, is significantly lower than amongst middle-aged people, my generation,
really?
And the younger. Yeah, I mean, they've exercised a fair amount of moderation. But what you just alluded to is a growing problem, just because of the feature that you alluded to but didn't name, denial.
Yeah. Well.
Denial is part of substance abuse and substance dependency. Always, every single person who's in either of those two categories at some point gets there because they deny they have a problem. But denial is aided by the medical profession. We doctors tend to prescribe medicines for older folks, believing that they're not likely to be abusers.
Yes.
And they're medicines that people need, painkillers for chronic pain, for example. And they don't often give them the appropriate warnings about the risks and hazards of these drugs.
Well, that would be very important to actually explain to people. Now, look, there's some certain risk associated with this. Now, there was something associated that I overheard about even something as allegedly benign as Tylenol, that there are substances there or within that drug, that well-known and heavily used product, that might have a risk for certain people.
The main reason I wanted to do this show is to get this message out. This is something that's bothering me for a long time.
Well, here's your chance.
Okay, here it is, folks. Tylenol is the brand name of a drug called acetaminophen.
Acetaminophen.
Okay.
Yes.
Acetaminophen is a wonderful drug. It's one of the best over-the-counter drugs you can buy. It's a great painkiller, and it's a great way to reduce fever if you're, have the flu or any other febrile illness. Acetaminophen occurs in a lot of other medications without being named. I mean, it's on the label, but people don't necessarily know. For example, Vicodin, Percocet, Darvocet, other medications that contain narcotic. The problem is acetaminophen is really not intended for chronic use. It's not a good drug to use every day for any period of time.
So it's not like aspirin where there are some benefits to taking one aspirin a day.
Exactly, exactly. Now you can get away with low-dose chronic use of acetaminophen. We're talking about 1 or 2 tablets a day if that's what you need. The problem is a lot of people out there in the 2 generations we're talking about are taking drugs like Vicodin, Percocet, because they have legitimate need for pain control. The doctors maybe don't tell them that if you take 4 grams a day of acetaminophen, which is 2 extra strength Tylenol 4 times a day, or Vicodin, I think that contains a half a gram, so that'd be 8 Vicodin a day, which is not a large dose for people with a lot of pain. You're going to do damage to your liver in as short a time as a week at that dose. If you're a drinker at all, the risk goes up even more. And,
because the liver's the target here, isn't it?
whether life is or is not worth living depends entirely upon the liver, as has been said. That's a joke, by the way.
Okay, I will laugh.
I'll tell you when I tell jokes.
Okay.
But seriously, the single biggest cause of liver transplantation in this country is acute overdose of acetaminophen.
Wow.
And not that far behind it are people who chronically use large amounts of things like Vicodin. Now the problem is their family and friends and sometimes their doctors will tell them, you're becoming an addict, you're using too much, and they focus on the narcotic.
Right.
Trouble is, the narcotic is not the problem. You can take stable doses of narcotics for the rest of your life, and if you don't fall or crash or do something that is related to reduced central nervous system alertness, it won't do you any damage at all. But the acetaminophen in these drugs will wipe out your liver eventually.
Well, what's a thinking person to do? Growing aches and pains is associated with growing older. I'm a living proof of that. Things do hurt. I mean, knees bother you, and your hands are becoming arthritic. And what do you do?
Okay, that's a very good question. Here's the answer. Find out what's in the pills you're taking for your pain. If acetaminophen is one of the ingredients, talk to your doctor about it. If you have to take large doses, and a lot of people do, and by the way, I am a strong advocate of treating pain. I don't think people should be heroes.
Right.
They should take what they need to remain comfortable. Find out from your doctor what other medications that are equally effective, maybe that have narcotics in them as well, don't contain acetaminophen. There's aspirin-containing compounds. There's compounds with ibuprofen. You can get straight narcotics sometimes. Some doctors are afraid to prescribe those, but, as I said, most people can moderate their use. Just be aware of and be careful of the amount of acetaminophen. It's also in cough syrups. So you have to look on the label or ask your doctor, but don't take any pill like that in high doses for any length of time.
Well, those labels, that little tiny printing is really a challenge for so many of our seniors. It's difficult to hold that bottle and be able, if your light's not strong enough or your visual acuity is dropped, you can't read that stuff. Now, what do caregivers do? Because a good chunk of our audience are actually caregivers for seniors. What are some of the telltale signs that may alert them to a growing problem, if not a real problem?
Well, with acetaminophen-containing drugs, there are no telltale signs. That's the problem. I mean, you wake up one morning and you're in acute liver failure. There may be signs and symptoms of encroaching liver failure, nausea, vomiting. You may turn yellow. But generally speaking, it sort of sneaks up on you. Most of the time, people's dose gradually increases until they reach some comfort level, and they don't realize that they've exceeded that 4-gram-a-day threshold. Wow. And as I said, in my experience, doctors don't warn patients enough. So the caregivers ought to be caregivers can read the labels. If they can't get a magnifying glass, find somebody who can.
Is it a good idea to have a periodic review with your physician or whoever's treating you to say, look, let's talk about these drugs. I've got a lot of them.
It's a terrific idea. Unfortunately, the average older person will come back with, my doctor's just too busy.
Oh.
And they're afraid to approach their doctors, and in a lot of cases, they're justified. These days, go to your pharmacist.
I see.
Pharmacists can do this. They love to do it. They're trained. They know how to educate. And they may, if you go to one pharmacy, they may know better than any particular one doctor what you're taking.
Well, I understand these days when it comes up on the computer screen, they may be able to see, hey, there's an indication here that we need to talk to you about because you're taking two drugs that maybe don't work well together.
Absolutely.
And that's a good thing.
Now, I don't agree with pharmacists, making, let me take that back. Recommendations are fine. There are pharmacists who are a little bit more active and actually will talk people out of their drugs. I'd say take what the pharmacist tells you and contact your doctor if there's a serious admonition in there. If they're really concerned about something, call the doctors involved and tell them what you would like to do.
Well, but part of this is that we are swimming in a sea of messages about drugs and alcohol, and sometimes it's very difficult to figure out where the moderate path is. Now, doctor, it's time for a short break. When we come back, we will continue our discussion of senior substance abuse. We'll be right back. Don't go away.
I remember when Dad used to help me. Boy, how things have changed.
Yes, I need to make an appointment for my father, Jose Alvarez. Right. Hey, listen, I'm going to be late to that meeting. I got to take my dad to a doctor's appointment.
It's really hard juggling my career with the needs of my dad.
Well,
I sure wish Mom was here to help. I can't do it alone.
Welcome back to Aging in LA. Our topic today is senior substance abuse, and our guest is Dr. James Spahr, a physician specializing in geriatric psychiatry. Dr. Spahr, alcohol is the larger problem that we're dealing with here, isn't it?
Yes, by far.
And that kind of cuts across all socioeconomic classes. Ethnicity doesn't seem to matter. It's a problem. So what can a person do? What are the options for treatment? How does a person get help?
Okay. Well, that's a tough question. I think you have to sort of answer that in categories.
Okay, we'll do it.
You know, if you're a substance abuser, if you drink too much alcohol and so that you get into trouble in one or more of those four categories I mentioned earlier, you may not necessarily be a very heavy drinker. You may not drink every day. You may not drink that much. You may be, for example, a binge drinker.
Right.
You drink on weekends, or you drink, under certain circumstances, and that gets you into trouble. If you're in the more serious category of alcohol dependency, now we're talking about people that, have tolerance. They have to drink more to get the same effect.
Right.
They have withdrawal if they slow down or stop, and the withdrawal from alcohol can be very dangerous.
It can be lethal, in
It
fact.
can be lethal,
yes.
yes. They have a tendency to, try to quit and try to cut down and be unsuccessful at it. There's a lot of other features of substance dependence that mark it as a much more serious syndrome. So it depends on which category you're in. If you are an abuser, I think the first thing to try to do is cut down.
Right.
Reduce your drinking to below the point where you're going to be getting into trouble in one or more of those four categories. Now, there's a lot of controversy in the field as to whether people can really do this. Some experts point to the fact that, for a lot of people, one drink will get them started and then they can't stop. But I really believe that the great majority of people can moderate their drinking. And if they're substance abusers, they can learn to drink less enough that they no longer get into trouble. If you're substance dependent, or if you're alcohol dependent, it's a little bit different story. So the treatment, I think, for either category, depending on how much you drink, starts with detoxifying.
Right.
If you're drinking so much that withdrawal is a significant issue, then you have to detox. You have to get off the alcohol.
And that may require hospitalization,
That may
correct?
require hospitalization. A lot of people can do it on an outpatient basis. It pretty much has to be done under medical supervision of some sort.
Right.
And it usually involves a kind of a process of stopping your alcohol and replacing the alcohol temporarily with a medication that will prevent withdrawal.
Right, I understand.
Okay, and then you taper off the medication. More serious cases do require hospitalization because, as we said, the withdrawal can be fatal. So first, you get one way or another, either you detoxify under medical supervision, or if you're not drinking that much, you just gradually cut down. If you find that you can't keep your drinking at a moderate level, then I think we have to face the fact that you can't drink at all.
Right. Well, that's the decision I had to come to more than 15 years ago, is that I just can't drink. All of those triggers that they talk about, hungry, angry, lonely, tired, the HALT, red flags, Those things happen to ordinary people. You get hungry, you get angry, you get lonely, you get tired, and human beings, human beings have been getting high since we started out here. It seems to be a natural consequence. It's something we appreciate. Now, we recently visited the Jewish Family Service Multipurpose Senior Center in West Los Angeles and spoke with Linda Gringas, a counselor in their senior substance abuse program.
Jewish Family Service is a wonderful social service organization that provides a variety of services to anyone of any background. We provide comprehensive services for seniors, and specifically my role is to provide substance abuse evaluation and assessment for seniors and their families and for anyone else affected by substance abuse. I think something that's so important for us to remember is that substance abuse can be a problem for anyone of any age. So often with an older adult, we don't think about them as somebody that might have a substance abuse issue. But adults are very savvy now with the availability of prescriptions on the internet. Even homebound seniors have ways to get prescriptions. It's a whole different world out there. So I think that the one thing our agency really wants to emphasize is that services are available. Be aware, be educated. If it's going on for yourself, if you have a loved one that you think might be affected, call and ask the questions. Get educated, and we can help you with the treatment plan.
Linda spoke on what happens when someone calls for help with substance abuse.
When someone calls our agency, initially we'll take some basic information. We'll help them to feel comfortable starting the conversation. It's a very difficult conversation for a lot of people to have. To acknowledge an issue going on is so difficult, and it's often very scary. We want to encourage the person to feel safe about discussing it. We'll invite them to come in for an initial comprehensive assessment where we'll go more in depth about not just their substance use, but their lifestyle and their needs. And along with that client, we'll develop a comprehensive treatment plan. And that treatment plan can, depending on the severity of their issue, range from anything from making a referral outside of our agency to a residential facility or continuing to provide services within our agency. We will also encourage the client to include any family members that might be affected by their substance use. In fact, often the initial call doesn't come from the client or the identified client. The initial call may come from a caretaker or a family member who has started to recognize that something is changing. And when we talk about substance abuse with seniors, it's such a challenge because so often signs of intoxication or substance use mirror normal signs of aging. So a family or a caretaker may not realize that there's an issue of intoxication or substance abuse. Or perhaps the substance abuse is very subtle. There was a prescription for a medical condition, and it was a legitimate prescription, but over time the medication has been abused, or perhaps the client doesn't understand how it's supposed to be taken, and they end up taking too much or too little, and then develop an issue. One specific story that stands out for us is that often we get calls that are triggered not by somebody identifying a substance abuse issue, but by any of the other many issues that may burden a senior. And I'm thinking about a specific time when we got a call to visit a senior and do some case management and evaluation. This particular senior had a number of open prescriptions. I think it was over 20 different prescriptions for multiple conditions. Some of them were overlapping and redundant, and the senior was having difficulty financially keeping all of these prescriptions open, but was also very confused. And so one of the things we were able to help her with is just to do some basic medication management, to realize that she didn't need 4 different medications for sleep. She didn't need 3 different medications for depression. And of course, to do that, we involved her entire treatment team. We involved her case manager, we got her doctors to talk to each other, and we were able to do a medication evaluation and help her to manage them better financially, but also to address her health issues.
The Senior Substance Abuse and Mental Health Program of Jewish Family Services is located in West Los Angeles at 8838 West Pico Boulevard. Their phone number is 310-247-1180. Doctor, we were talking about the issues and how to identify them. What are the downside risks? Why is this such an important subject about the abuse of any kind of substance?
Excellent question. I think that in addition to the sort of garden variety risks, driving, liver disease if you drink too much for too long, and of course getting into trouble at work, etc. I think for the older generation that we're talking to, at least the people over 80, in many cases people over 70 even, the single biggest risk associated with use of alcohol or other psychoactive substances is falling.
Falling, yep, the broken hip. Why?
The broken hip, that's, for many people, that's the last bad thing that happens to them.
Right.
It leads to one complication after another, and it turns out ultimately to be a fatal event.
Right.
Falls are the single biggest cause of visits to the emergency room amongst the two generations we're talking about. All the substances we're talking about increase the risk of falls. So I would say, as much as I have emphasized the fact that people can control their drinking, most people, still, if you are somebody at risk for falls, if you have a history of falling, if you have a musculoskeletal or neurological condition, strokes, arthritis, that increase your risk, you have to be extra special careful.
Well, and you can also be engaged in activities where the risk of falling is inherent. For example, bicycle riding, or if you've always ridden a bike and you think you're fine and you're over 60, a fall there can be really pretty hurtful.
Yeah, well, I wouldn't recommend drinking before you go out bicycle riding.
Thank you. Our time is up for today's edition of Aging in LA. Thanks so much to our guest, Dr. James Spahr, a geriatric psychiatrist at the UCLA Semel Institute. And now it's time for our new feature on Aging in LA, Senior Stat Shots, where we look at statistics that pertain to senior citizens. Did you know that just 3% of senior citizens in America have proficient health literacy? And that's a particular problem when it comes to understanding medical instructions, according to a recent report by the National Center for Education Statistics. Less than 15% of U.S. adults have proficient health literacy. But for seniors, that number is only 3 out of 100, 3%. The report indicates that healthcare providers, health insurers, and pharmaceutical companies must improve their communication skills to ensure patients understand basic medical instructions. And that's today's Senior Stat Shot. The Los Angeles Department of Aging produces this program with CityView, Channel 35, so that seniors living in Los Angeles and surrounding communities are well informed on the many issues that face them in everyday life. I'm Paul Peterson. For the Los Angeles Department of Aging, the people here at CityView, Channel 35, and our guests on Aging in LA, thanks so much for watching. We'll see you next time. Dr. Spahr?